Imagine taking your diabetes medication exactly as prescribed. Every morning, same dose, same time. But one simple breakfast choice quietly makes that medication work slower, weaker, or unpredictably. Not because the drug failed, but because food changed how it worked inside your body. And here's the uncomfortable truth. Some of the foods people trust as healthy can interfere with diabetes medications in ways most patients are never warned about. Today, we're breaking down the real science behind food-medication interactions in diabetes. Not diet myths, not fear-mongering, but physiological effects backed by research. By the end of this video, you'll know which foods disrupt medication timing, which foods increase blood sugar spikes, which choices raise the risk of low blood sugar, and how to fix all of it without adding another pill. What foods that interfere actually means. When people hear foods that interfere with diabetes medications, they usually think it just means sugar. But medically, interference means something more specific. In pharmacology, food-drug interactions occur when food changes, how a drug is absorbed, how fast it reaches peak levels, how long it stays active, or how predictably it works. This doesn't mean the drug stops working. It means the timing and control of blood sugar becomes unstable, and in diabetes, timing matters. This doesn't mean the drug stops working. It means the timing and control of blood sugar becomes unstable. And in diabetes, timing matters. Even small mismatches between food absorption and medication can lead to high blood sugar after meals, unexpected crashes later, or the false belief that a medication isn't strong enough. 1. Dietary fiber. Helpful but misunderstood. Let's start with one that confuses many people: dietary fiber. Fiber is strongly recommended in diabetes guidelines, and for good reason. Higher fiber intake is associated with better insulin sensitivity, lower HbA1c, more stable post-meal glucose levels. Now here's the key clarification. Fiber does not cancel diabetes medications like metformin. Metformin works by reducing glucose production in the liver, improving insulin sensitivity. Soluble fiber, found in oats, legumes, vegetables, and whole grains, slows carbohydrate absorption in the gut. Together, they create a smoother glucose-lowering effect. However, very high fiber meals can slightly delay metformin absorption, meaning the drug peaks later. Blood sugar control becomes more gradual. This is not a negative interaction, like it's a timing shift. That's why some patients feel their medication works slower after high fiber meals. But overall control often improves. Don't avoid fiber. Use it consistently. 2. Refined grains. The timing mismatch. Now let's talk about foods that genuinely cause problems. Refined grain foods are rapidly digested and absorbed, causing sharp glucose spikes. Examples: white bread, white rice, regular pasta, bagels, croissants, and sugary breakfast cereals. Here's the issue. These foods raise blood sugar faster than many oral diabetes medications can respond. This creates what researchers describe as a pharmacodynamic mismatch. The medication isn't weak. The glucose surge is simply too fast. The result: high post-meal readings, frustration, and sometimes unnecessary dose increases. 3. Fruit juice. Not the same as whole fruit. Fruit juice deserves its own category. Examples: orange juice, apple juice, grape juice, or 100% juice products. Whole fruit contains fiber. Wild juice does not. Without fiber, fruit juice raises blood sugar almost as fast as soda. When consumed near medication times, juice can overwhelm glucose-lowering drugs, making patients believe, "My medication isn't working." Whole fruit behaves very differently. Juice changes the equation entirely. 4. High-fat, heavy meals. Delayed absorption. High-fat meals slow stomach emptying. Examples: fried foods, burgers, pizza, fast food meals, cream-based dishes. When stomach emptying slows, oral diabetes medications are absorbed later. Peak action is delayed. This can lead to prolonged high blood sugar after meals, poor control later in the day. Again, a not drug failure. Food changed the timing. Real clinical case study. A documented U.S. clinical case involved a patient with type 2 diabetes taking Metformin, a sulfonylurea. Despite perfect adherence, glucose remained uncontrolled. Diet review showed frequent intake of white bread, breakfast cereal, fruit juice. No medication changes were made, only food substitutions. Whole grains replaced refined grains. Juice replaced with whole fruit within 8 weeks. HbA1c improved significantly. Same medications, same doses. Different foods, completely different results. If this kind of science-based breakdown helps you, make sure you're subscribed. This channel explains medications without myths or fear. Foods that increase low blood sugar risk. High blood sugar gets most of the attention in diabetes, but low blood sugar can be just as dangerous and often more immediate. While high glucose causes long-term damage, hypoglycemia can cause sudden symptoms like dizziness, confusion, sweating, shakiness, heart palpitations, and in severe cases, loss of consciousness or seizures. This risk becomes especially important for people taking medications that actively lower blood sugar rather than simply improving insulin sensitivity. This section mainly applies to insulin. Insulin-stimulating medications such as sulfonylureas, thiazolidinediones. And it's important to clarify, metformin alone rarely causes hypoglycemia, but the foods you eat still influence overall glucose stability. 1. Very low carbohydrate meals. Examples include the protein-only meals, meat and eggs without carbohydrates, extremely low carb or zero carb meals. Diabetes medications lower blood glucose assuming some carbohydrate intake will be present. When little or no carbohydrate is consumed, blood sugar may fall too far, especially during peak drug activity, increasing hypoglycemia risk. This isn't a medication error, it's a food medication mismatch. 2. High glycemic foods. Followed by long gaps. Examples: sugary snacks alone, white bread without protein. These foods cause rapid blood sugar spikes followed by sharp crashes, which diabetes medications can amplify hours later, especially when meals are delayed or skipped, significantly increasing the risk of unexpected hypoglycemia. 3. Unbalanced light meals. Examples include just fruit, just yogurt, just toast. These meals may feel sufficient, but they digest very quickly and can destabilize blood glucose when medications are active, leading to rapid rises and falls that increase variability and hypoglycemia risk. Balanced meals slow absorption, provide sustained energy, and improve overall medication safety. Why this matters. Repeated hypoglycemia is linked to falls, heart rhythm problems, cognitive impairment, fear-driven medication skipping. Many patients lower or stop medications, creating long-term harm. Often the solution isn't changing the drug, it's changing how food supports the drug. Evidence-based principles from diabetes research. Choose whole grains over refined grains. Eat whole fruit, not juice. Use fiber consistently. Avoid skipping or unbalanced meals. Focus on consistency, not extremes. Medications don't work in isolation. They work inside a system shaped every day by food.